Now moving towards the scoring system in acute appendicitis, which is known as the Alvarado scoring system or Mental's scoring system, which ranges from number 1 to number 10. The first one is the migratory pain, the second is the anorexia, the third is the nausea and vomiting. These three has score 1. The fourth is the tenderness in the right iliac fossa, which has scored 2. The fifth is the rebound tenderness, which has score 1. The sixth is the elevated temperature, which has score 1. The seventh is the leukocytosis, which has score 2. And the eighth and the most important is the shift to the left, which has score 2. Now moving towards the result of this system, if a person has score 1 to 4, then it is negative for acute appendicitis. If a person has score 5 to 6 out of 10, then the person is equivocal, that is, it is a most dangerous condition and it can be diagnosed by CECT, which is contrast enhanced computed tomography. If a person has score 7 to 8 out of 10, then the person is most likely to develop acute appendicitis. And if a person has scored 9 or 8 out of 10, then the person is certain for acute appendicitis. That is, it is positive for acute appendicitis. You are familiar with the signs of acute appendicitis like elevated temperature, rebound tenderness, tenderness in the right iliac fossa. Now I will be discussing with you some other signs in acute appendicitis, which are also present in some of the cases, but they are the most important ones. The first one is the rosing sign, which is a pain in the right iliac fossa on pressing the left iliac fossa. That is, when we touch the left iliac fossa of the patient, he will experience or suffer pain in the right iliac fossa. The second is the Aron sign, which is a pain in the epigastrium. The third is the Tenhorn sign, which is the pain in the right iliac fossa on pressing or gentle traction of the right testis. That is, when we touch the right testis of the patient, he will experience pain in the right iliac fossa. The fourth is the Dunphy sign, which is a pain on cuffing. That is, when the patient cuffs, he will experience pain in the right iliac fossa. The fifth and the most important sign of the acute appendicitis is the SOS sign, although it is only present in patients suffering from retrocecal appendicitis. That is, when the patient will have the appendix in the retrocecal, then this sign will be positive, and it is a hyperextension at the hip joint which causes the pain in the right iliac fossa. That is, when we ask the patient to lift up his leg at the hip joint, then he will experience pain in the right iliac fossa. We have been familiar with the signs and symptoms and clinical features of acute appendicitis. So now how will we treat the patient? The treatment is different for children and adults. In children, we cannot hold the children for a long time because they don't allow us to carry out clinical investigation, and the appendicitis is purely a clinical condition. Like, on the basis of signs and symptoms and clinical features, we can diagnose that the person is suffering from acute appendicitis. But in case of children, we cannot do clinical examination. So the investigation of choice in case of children is ultrasound, whereas in case of adults, it is solely clinically. But the gold standard method in case of acute appendicitis is CECT, which is contrast enhanced computed tomography.